Managing bladder problems after a stroke. Scripted dialogue based on a real hospital conversation. Background. A stroke survivor comes back to the hospital for a follow-up appointment. The doctor and the patient are going to discuss how to manage changes in bladder control after a stroke. Keywords.
Waterworks, Botox injection, nocturnal polyuria, flow test, suprapubic catheter, overactive bladder, incontinence, urodynamic test.
The conversation starts now.
So, tell me what's going on with your waterworks at the moment. Last year you said the incontinence had improved a bit, but you didn't want any treatment options at that time. What's going on now?
Well, during the day, I can usually make it to the toilet, but sometimes I leak a little. At night, though, I have no control or awareness. I only realize I've peed after the bed is already wet.
I see. That's quite common after a stroke. The nerve control of the bladder can change, and the bladder becomes overactive. It tries to squeeze even when it's not full. My job isn't to make your bladder go back to what it was before the stroke. That's not realistic. But to help you manage it better and improve your quality of life. Sometimes we check how your bladder behaves with a bladder diary or even urodynamic tests to see if you are producing too much urine at night, what we call nocturnal polyuria.
I see, but measuring that at night is hard because I use pads.
That's okay. You can weigh the pads before and after. That gives us a rough idea of how much urine you're making overnight. In terms of treatment, we've talked about two main options. One is suprapubic catheter, a small tube inserted through your lower abdomen so your bladder drains automatically and you don't need to get up at night. Perhaps from a quality of life and an ease of toileting and a nighttime peeing point of view, the best option for you would be to have a suprapubic catheter, where we put a permanent catheter in through the tummy so that it's draining and you're not having to get up to go to the toilet. Sometimes even with that, the bladder can still be a little bit irritable and it can squeeze and you can get some leakage of urine. And if that happens, we would recommend some Botox injections into the bladder. Now, the intermediate part of that is maybe we just do the Botox first and see how you go. But the risk of that is that the Botox acts by paralyzing the bladder muscle so that the bladder can't be squeezing so vehemently and so often. Sometimes, though, people struggle to pee afterwards and still need a catheter. So I need to know what your priorities are in all of this, because we've discussed this a couple of times and you won't keen on either Botox or a permanent catheter at that stage.
I understand. Honestly, I'd prefer to try the Botox first rather than having a permanent tube in my tummy. But I'm a bit worried about not being able to pee by myself afterwards.
That's a fair concern. It's not definite that you would need to have a catheter, but the risk of Botox is that sometimes it works too well and people struggle to pee and may need one temporarily. So that's always what I say to people. Would you prefer to be dry but with a catheter or keep things as they are, which might be a better quality of life for you?
I think for now, I'd like to just monitor it a bit longer. Maybe I'll reconsider if things get worse.
That's fine. For now, we just need to keep an eye on how well your bladder is emptying to make sure those residual volumes aren't creeping up over time. When you go to the toilet, try to empty your bladder completely. Wait for a moment and try again. We'll review you again in a year. If you change your mind, you can ask your GP to re-refer you back to us. Next time, we'll also do a flow test to check how well you're emptying your bladder.
Recap. Waterworks. The doctor asked how my waterworks had been since the stroke. Botox injection. Botox injection helps relax the bladder muscle and reduce leakage. Nocturnal polyuria. The doctor suspects nocturnal polyuria because the patient urinates several times every night. Flow test or uroflowmetry. A flow test helps doctors understand whether a patient's bladder muscles and urethra are working properly. Suprapubic catheter. The patient had a suprapubic catheter inserted to help drain the bladder. Overactive bladder. Overactive bladder makes people feel the urge to urinate even when the bladder isn't full. Incontinence. The patient developed a urinary incontinence after the stroke. Urodynamic test. The doctor recommended a urodynamic test to assess bladder function. That's it for today's learning. Thanks for watching Yasmin Medical English Pond. See you next time.